communities about this vaccine, how it works, and why we all need to get vaccinated. And as Dr. Lisa Green said, COVID did not care if you were a doctor, Indian chief, whatever, right? It affected my family. I'm sure it's affected your family as well. And so I'm excited to really talk about these concerns, to get the myths out of the way and really hear the information that we need so we can move forward. We can move our families forward that have not been vaccinated yet. So thank you so much.
So thank you for introducing yourself. I just want to give a few ground rules. So first, we're going to have both of the doctors to speak. We'll have an opportunity for people to ask questions. You can leave your questions in the chat and we'll be sure to get them answered for you. So we're going to get started with Dr. Green with some information, some of the latest COVID updates, information for you.
So as you know, we finally beginning to make the turn with COVID, right? In Illinois, a lot of our communities are up to 70%, which is, outstanding and amazing. Yet at the same time, we're not ready until it's all of us. And so I have to be, honest when we say, part of the mandate that we have is that if, 70% of our communities are vaccinated, people that you're around, you could take your mask off, have a little bit more comfortability and a place of normalcy back, right? But all of our communities aren't there yet. And so we have to really ensure that we continue to educate and vaccinate, in our communities. We are starting to see a slow tick up. So in the southern suburbs, when you look at COVID and the communities that were highest vaccinated in the county of Cook, those who've reached the high numbers, 70, 80% happen to be in the northern suburbs, right? When you look to the southern suburbs and the south side of the city, those numbers aren't the same. Those numbers can range from, 15 to 20% up to 50%. And that's a big gap and big difference. But you also look at those communities are also divided by the zip code is economic based as well, right? So, but when we look at COVID, like I mentioned earlier, it doesn't matter that, and so I think that though we are beginning to make strides that are slow, we still can't stop with making those strides. And I think there was some confusion that when we took the mask mandate off, people took a signal that we're done and it's over with. And so I don't need to wear a mask anymore. We're good. And even if I got COVID before, then I don't need to get vaccinated and we're done. And that's not the message that was intended to occur. And so I think it is conversations like this. It is conversations that people have to have with their primary care physician, where it's factual information that they're getting, not just a post or that they saw on TikTok or YouTube or somebody posted on the internet, and none of which is really like evidence-based. So I think, part of the discussion again like this is to allow people to ask some of those questions that they really want to know the answer to. And because there's been so much distrust, but, rightfully earned and so, right? So we have to realize that. And I say this all the time, people's perceptions are their reality until we break it down for them. And so I think we can't just assume, you need to get the shot. You need to engage. And that's what we're trying to do in the southern suburbs and in our communities that are slowly getting vaccinated, is tell me why you don't want the vaccine. Let's have that conversation. Let's empower you with some other knowledge. And even while you're deciding to get the vaccine, let me tell you why it's still important that you wear the mask. So what we found out is instead of having some of the larger events now, we have to have some of the smaller events. And the smaller events, sometimes you got to be happy with the little wins, because the little wins, as you continue to pick up, will come into larger wins. And so as we begin to have those conversations at the schools, at the churches, in the grocery stores, so like in a lot of our neighborhoods, like Dr. Mcguire can tell you about, it had to be to the point where we had to go to the little local restaurants, to the gas stations, to places to just have conversations with people and giving them more information and answering their questions. I think that's a big part of it, is people don't always have the opportunity to answer questions in a way that they don't want to seem stupid. And so they take what they've heard and, that's it, and keep moving. So again, it's the impact that Cook County Department of Health has come along, and we've partnered together in all of those venues to get us there. So for example, Harvey was one of the lowest vaccinated communities, and a couple of weeks ago, we were still somewhere 11 to 15%. In a city that has, almost 30,000 people, right? Well, now we're at 22%. And so someone may say, well, you're still not at 70, but I'm not at 10, right? And so as I continue to do that and to educate the people that are appropriate, and need the vaccine, that's how we get there across the board. Dr. McGuire?
Fantastic. I just want to say how much I've been involved in the vaccination process, even as an OB-GYN. We know that our moms need to get vaccinated. They did a study, and this study was done through one of our big journals, and they found that women who are pregnant are 22 times more likely to die from COVID infection than a non-pregnant mom. So yes, our pregnant moms need to be vaccinated. They also saw that those moms who are pregnant they are at a higher risk of preeclampsia, infections with COVID infection. So it does not stop our pregnant moms from getting vaccinated. I was part of, and still am a part of, Cook County Department of Public Health, where we were out in the community. We were actually on 79th Street answering questions and vaccinating folks, right? Taking the vaccine to the community was really important, because we know that access to the internet and making, their appointments was challenging for many. We also know that the vaccine is safe and effective. It's not a live vaccine. So when we vaccinate you, we're not giving you COVID. But what we're doing is we're giving you and your body the ability that if you do get a COVID infection after being vaccinated, that you are not hospitalized and you don't die from COVID. And that's really, really important, especially in our communities that have a higher rate of death and severe infection and hospitalization secondary to COVID. So yes, pregnant moms need to be vaccinated. That helps to protect their unborn child. Even nursing moms, those antibodies that are passed to their babies help to protect their babies, as well as those who are even thinking about getting pregnant. You may be thinking about getting pregnant. We saw a lot of pandemic babies that have been born now during the time we were all quarantined. But yes, it's really important that we vaccinate our pregnant moms and we vaccinate those who are thinking about getting pregnant, because pregnancy puts those moms at a 22 times higher risk of dying from the COVID-19 infection. So I'm a huge advocate. I think I've vaccinated personally over 1,000 patients since the December rollout of this vaccine. Not only are we in the community on the south side, but the suburbs and beyond, just making sure that our communities understand that this vaccine is safe and effective. And one other thing I just want to bring up that was probably a mistake of the media when they use the word warp speed. It really gave the impression that this vaccine was just magically taken out of our back pockets. But this vaccine, the Pfizer, the Moderna, the Johnson & Johnson, they all went through those clinical trials to ensure that they were safe and effective for those that, that we've been using the vaccine on. So that's another thing that really you need to understand, that that process was not rushed. That process went through its clinical trials to ensure that this vaccine is safe. Any questions so far that are in the chat?
Thank you so much, both Dr. Green and Dr. Mcguire. And I just want to just say hats off to both of you for meeting the community where they are. That is so important as we try to reach some of our most vulnerable populations, and we continue to just give them information and hope that they will to get vaccinated. So I do have a few questions that I want to get started with. So one of the questions so one of the first question is, will the vaccine change my DNA? We've heard this question a lot, so I would like for you to answer. Start with, will the vaccine change my DNA?
No, the vaccine does not change your DNA. What it's doing, it's taking a picture of the spike protein, which is what's infectious in COVID. And what happens is it gives your body this picture so that when it sees it, it says, oh, okay, wait a minute, this is the enemy. So when I see this again, I need to mount up a response so that when it gets to, if it tries to come back, I know how to take care of it. And so what I tell people, it's like a lock and a key. So the spike protein, which is in the SARS vaccine, which is in the SARS virus, it comes in and it attacks. And that's why we hear people, have problems with their breathing and their lung, but they can have a stroke on their brain. It could affect their heart. It could affect their kidneys, because these spike proteins are just trying to duplicate and survive, and they go everywhere. But when you get the vaccine, it's not changing the DNA. It's taking a photo picture, almost presenting it back and say, wait a minute, make this army. So that way, when you're presented and you see anything like this, no matter where it attacks, when it goes to spike, your cells have a key to lock it down and to lock it down through the immune system response that's created by the body.
Yes. Very, very good. I like that. I like that analogy, Dr. Lisa Green. When you think about the DNA, this vaccine doesn't even enter the nucleus. It's on the outside, the cytoplasm. As Dr. Green says, it gives that body that memory that if it sees COVID, it will have those proteins that it's already made in the body ready to defend, ready to help you fight off the COVID infection. Because what we know is that the vaccine will protect you from a severe infection, hospitalization, and death.
Absolutely. Sandra, the next question.
I'm back on. So thank you for that great analogy. And it's just making the information digestible for, everyday people. So just thank you for simplifying the information for our audience today. The next question is, I've already had COVID. Do I still need to be vaccinated?
Absolutely.
Yes, still need to be vaccinated.
I had people that have had COVID twice, and one of them was deathly ill, and was actually under 50, didn't have any other pre-existing conditions, but the impact on her also mental and physical health, it took a toll. It took a strong toll for people. And so because you've had COVID before does not mean that you cannot get it again. And let's remember, we still have these wild cards, these variants. And as the variants are changing, there's always an opportunity then for the body to not have enough of an immune response to be able to fight that off. So the answer to that is yes.
Thank you, Dr. Green. The next question is, I have diabetes and I'm afraid to get the vaccine. Should I?
Because you already have diabetes, that means your immune system is already compromised already, and it puts you at a higher risk. We know that when people have a pre-existing condition already, and especially for diabetes, the body is already fighting and working through this whole insulin and making sure it's a balance already. So because of the struggle that's already going on there, and the cells are a little, and the body is already compromised, it just makes it easier for COVID to just swim and just come jump right on in, because it realized there's some imbalance going on already. And so because of that, it puts people at a higher risk. That's one of the things that we found in COVID. We found in COVID early on, is that there were people who were borderline diabetics prior to that, who still were waiting out. Let me get to the gym. Let me lose some weight. I don't want to take any medicine yet. Just give me a little time and I'll get there. But it ravished their bodies. Some of them are now on permanent insulin. People had renal failure. So there were so many complications for people that had diabetes, and because of that risk factor. So that's why we currently strongly recommend for people who have any underlying risk factors such as diabetes. Because let's remember, diabetes just doesn't stay in one cell. Diabetes can then affect your eyes. You get retinopathy. It can affect the nerve endings, the fingers, the hands. It can affect the kidneys. And because it has such a diffuse impact already, you want to be able to protect it from having any further damage.
Thank you. I've seen posts claiming that the mRNA vaccines used against COVID-19 targets the protein needed for a successful pregnancy, implying that the vaccine will make people infertile.
So the messenger RNA, that is the Pfizer vaccine, when they rolled out the clinical trials, there was no one pregnant in those trials. But what they found was that after they did those trials, 23 patients got pregnant. And they're following these patients. What they found is they found that those patients did not miscarry. So far, they've had successful pregnancies, and the vaccine thus far has been found to be safe, has not found to cause any infertility, has not been found to cause any miscarriages, and should be given and offered to all pregnant moms, to those who are looking to get pregnant, thinking about pregnant, and those who are even breastfeeding now.
Thank you, Dr. Mcguire. The next question is, I heard that someone has died from COVID after being vaccinated. Is this true?
So there have been some occurrences that deaths have occurred. The question, though, is what we still have to figure out is, did they have any other pre-existing condition already? And looking at the timing of that. Now, is it 100% that there's not going to be any complications? There are sometimes that there are some, but we weigh the risk versus benefits, right? When you look at the masses and the majority, but if you're that one, that's like being 100%. But when we look at the chances of that and compare that to, getting hit by a bus, or, your plane catching on fire, or things like that, that's where we have to weigh that in. But at the same time, as a nation, as a world, then we take a close look to dive in to see if there's anything that's going to cause harm, that we stop that, we evaluate that. I think you saw earlier in the year, I remember they had given a vaccine out, and like 50 people had a complication. They realized they immediately stopped that because they saw that, okay, it was a batch in there, something may not be right, we need to hold back on that. So any of the times that there are things that have come out, there was I remember a physician actually, I think, that had died earlier on, and the family was doing an autopsy and everything to see was there anything that was it the messenger RNA, was it the vaccine, is it, so the autopsies and things like that are starting to look to see, but there had not been a significant number that said that it's specifically from, the vaccine. And so I think that's what makes it challenging for people. I never forget, who was that? One of the baseball players or whatever that passed away. And they're like, well, he was fine until he got the vaccine. So you know what? Nope, I'm not getting the vaccine. That's it. And we didn't even have any studies done yet. We didn't even know anything. But immediately we went and we posted everywhere that the vaccine caused death. And I think, but the reality of it is, it's a good question to ask, right? This is still an ongoing thing for us as we're trying to navigate through these waters, as we're trying to prevent death, at the same time, making sure that we're doing that on both ends. To do nothing, we would have had to continue to see the number of deaths that we were having, not just here, but around the world. If you look at India, where India thought they were great, they were good. And then all of a sudden, that fast, that many people, died in the country. And that is a devastating thing. And it was devastating for all of us. And so the good news that you have right now is that you have people that are looking at this all over the world. This is the one enemy that we all are fighting at the same time. Normally it's one country versus another country, and things like that. But the reality of it is, physicians and scientists and researchers are boots on the ground everywhere, and they're sharing that information. Hey, we saw this side effect. Are you seeing that in this country? What is it that you're going to do? Was it a certain age? Did they have diabetes? Did they have, should we make a precaution? Then so do we say and categorize, no, we shouldn't do it. For example, people that have had severe anaphylactic, do they get the vaccine or do they not get the vaccine? Well, you give it, but we watch them for 30 minutes as opposed to 15 minutes. So there's a lot of work that's ongoing in the process to ensure, to the best of our ability, as physicians, our number one thing is do no harm. And that's the whole goal. Has it been where there's some things and outcomes that they didn't expect? Yes, there has been. So no difference than we had people died years ago from TB or polio or things like that. And we had to move the needle to make a difference, not just for one, but for the masses, if that answers the question.
Yes. And that's really good. I also like, Dr. Green, how we have an opportunity once you get vaccinated to enroll in VSafe. VSafe is a really great way where they are collecting data. It's a program that when you go to the website and register, they will in turn text you every day to see if you're having symptoms, asking you critical questions after your vaccine about any untoward, unwanted side effects. So this data is really critical that we're getting, and we are paying attention to numbers and anything that falls out of the box so that we can really improve on our outcomes.
Right. And physicians are hiding more than ever before. We give somebody a vaccine and they say, I had my vaccine 2 weeks ago. And sometimes it's almost overkill. Well, I'm having a pain in my left eye. Okay, well, I want to make sure it's not the vaccine. Damn sure. Do I need to go CT scan? Do I need to get an MRI? Okay. People are doing, we do a good job anyway. Do not get me wrong, right? But at the same time, there's this extra added awareness because people do know. And we want to make sure that we are offering the best safe environment for our patients as possible. So the ears and eyes are listening more keen now, I think, than they ever. They've always been, but there's that extra heightened to it too, because you have to realize we as physicians didn't all just sign up and say, give me the vaccine the first day. We had our own questions. We had our own. I tell people, no, I don't even normally get a flu shot, right? And so now this was the year that I got a flu shot, understanding the patients. And we had to understand ourselves to make sure that we thought it was safe enough, because how can I get and tell somebody to get something that I'm not giving for me or my family? You can't do that. And it's not for me. Now I can't sleep at night. But I think that when we look at some of the hesitancy in our communities, we have to realize as educated professionals, we took a pause before we even, signed up. And so now we still have to give our communities who are vulnerable, who are in environments where they have not always been entrusted, and guided communities. And we have to come alongside of them to help them understand and to get there, right? And sometimes it just takes a little more time than others, but at the end, it's not about one of us. I keep saying it's about all of us.
Absolutely. I was one of the first physicians at Roseland to get the vaccine. That was December 22nd. I got my second.
I was nowhere near thinking about that then.
I got my second injection January 8th, and I tell you, my blood pressure was sky high. Yes, it was anxiety provoking, but I knew that I had to be an example for not only my family, but for my community and my patients. And what did I experience? A sore arm for 24 hours after my first injection. The second injection, my arm hurt for an hour, and that was it. And by me being there at the very beginning, vaccinating patients from the very beginning, I was able to see everyone come back for their second shot. And the majority of patients, 90% of patients, just had a sore arm. There was that small percentage that was sick for a day or two. They had fever, maybe they had body aches, but for the most part, everyone just had a sore arm like we see in other vaccines, local injection pain, and that's it. So, that experience is anxiety provoking, but it's important that we really let our patients know what to expect and not to be afraid.
Thank you so much for just your honest, transparent answers, because like you said, we have to be an example, not only for, of course, your patients, but our families. This is personal for all of us. As our family, we're like advocates for our families. I got so many questions just across the board, and just giving my family, accurate information so they could make informed decisions. I only experienced a sore arm, but, different family members experience really, really minor symptoms, but that's it. So I'm with you in making sure we're just, being an advocate and sharing information, not only with our families, but our communities, and just being open and honest about our experience. I did my own research. I consulted with my colleagues and also my physician, and I was able to make an informed decision. So that is what we're hoping, that everyone that is joining us today, that you're making informed decisions with all of the information that you're receiving today, not only for yourself, but for your children. So just thank you very much, Dr. Green and Dr. Mcguire.
I just want to add one thing, though. Yeah. I think the funniest part about being in the vaccine clinic is the expression after you give the vaccine. The patients are like, "That's it? That's it. It's a nice little needle, short and fast and quick." And they're like, that's it? Yep, that's it. So don't be afraid of the needle. The needle is small. It's very quick. The vaccine is it's not thick like the flu vaccine, so it doesn't hurt like the flu vaccine when you get those. But yeah, talk to your healthcare professional, ask questions, do your due diligence, do your research, and get vaccinated.
Right. That's the one thing that I was going to say, especially for those, because people with diabetes really were hard hit. And so I think that people want to, instead of just making the decision based on a post you saw, you really need to circle with your primary care physician and really ask risk versus benefit and going through things. And just because you're not on insulin, you still have diabetes, right? Even if you're pre-diabetic, and understanding that, whether we want to own it or not, you still need to have, and for those people who don't have a PCP or primary medical home, seeking that out, like, I'm affiliated, ours is a community, a fairly qualified health center. You can go to the Cook County Department of Health. You can go to a community health center, and we have sliding scales where you don't have to have insurance and you can still be seen. We can sign you up for insurance. And the other piece is to remember, it's documented, undocumented, we don't care, as far as with the vaccine and getting in. But those are the questions that you really want to ask. And to Dr. McGuire's point, a lot of people, because they're so anxious after the shots and they're so fast, they're like, are you sure you gave me the shot? Because
that's another one.
What is that? Are you sure? Because I didn't feel nothing. And do I need to get another one? Do you need to stick me again? And we're like, no, that's it. And so it's that 15-minute, waiting time. And so some people are very anxious in that first 15 minutes. Other people are, a little bit more relaxed. We have people put the timer on your phone. I like to go and educate people because I want you to know and be informed of why you got the vaccine so that you can tell your other family members and somebody else instead.
Absolutely. Thank you. Those were just great points. I too received text messages as my family began to be vaccinated. Oh, that's it. That's it. And although I'm no physician, but I definitely told them to consult with their physicians. But literally it was like, message after message. Oh, it wasn't so bad. And just things like that. So there are a few questions, and Dr. Green, you did just touch on this about, how much does the vaccine cost? Do you need insurance? Will I be required to provide an ID when I get the vaccine?
So what happens is when you come in that's what I applaud, kind of Dr. McGuire taking it out into the community to people. And that's what we found to be effective. Like we've done, thousands of the vaccines, but it's interesting when we go to on-site visits and we take walk-ins, it's an ID, but it doesn't have to be. People think, well, are they going to send me a bill? Are they going to come to my house? Are they going to track me? And I will tell you from my undocumented patients, they were more afraid of ICE than they were of getting COVID because that's real for them. And so we really had to do a lot with educating people that you're not going to get a bill. If you get a bill, just, send that back in because there's an administrative fee, but that's picked up or is waived. So you don't have to worry about that. There's no cost for that. And the information, they get your phone number and things like that, only because afterwards we send you a text message or an email link to say, hey, this is when you come back for your next shot. If it's in Pfizer for 3 weeks or if it is for Moderna for 4 weeks. That's the importance of getting a phone number or email information so we can give you the follow-up. It is not to call you back and to see, where you live, how many stimulus checks you got, and we're not doing any of all that. It's really just to ensure for the communication that you're able to get the second shot, because there are some people who've gotten the first shot, then they became fearful. They saw something on social media and they have not gotten that second shot. And so that's the reason that we try to educate people enough to let them know that this is the only reason that we're using that information. And we are telling people, do not post your vaccine card up on Facebook, because people, we found out, were selling vaccine cards and getting the information and duplicating them. And so do not share that information like that. Make sure that you keep it to yourself and that it is as personal. You can get a thing that says I'm vaccinated, but not with all your information on social media.
Thank you, Dr. Green. And just to add to that, you can go to the Cook County Department of Public Health website. We have a number of vaccine events around suburban Cook County, but also our Thornton Township High School site is open until Saturday. I believe that's the 26th, where you can walk right in. No appointment is needed to be vaccinated. Just wanted to make sure that everyone on the live today is aware of that. But also, please feel free to go to our website to find out about other vaccine events that are happening in or around your communities. So our next question is there a link between the vaccine and heart inflammation? What can you tell us about that? Mm-hmm.
So that's the one that they've seen in some of the kids in the Pfizer. And we began to see that at day 4, I believe it is, after the second shot. Where kids were presenting with chest pain, shortness of breath, and a couple kids end up in the emergency room. Some people ended up in ICU, but we're finding that they were treated and it was then short-lived. The question now is, why did it happen in that segment of population? And so we can't give you the answer tomorrow, right? So, but that's what they're doing to look to see, so that way cautiously, well, this kid should not get it because they fell in this particular category. But they have not been linked, or linked massive wide to that. But absolutely, yes, there have been some cases here, and not just in the United States, and other countries. And that's why I was saying the good news now is that this is an enemy that we're all fighting globally. And so when we find occurrences or things that are happening, that information is being shared quickly to ensure that there's caution, there's education out there to make sure that we're doing no harm in the midst of trying to do good.
We have a lot of thank yous in the chat. Just a lot of comments thanking both of you for answering the questions and just providing really useful information. So well received.
No, because I tell you, the Delta, we know travels faster.
Yes.
We think that it is more severe. And we now have an environment where we have people that have decided, I'm not getting the vaccine and I'm not wearing a mask. And so if that occurs, the Delta has to go somewhere. Where is it going? It's going into our communities, not just here in Southern Cook, but you will find that then across the country in those communities where they are not. If you look at the map, and the map shows, I think, was it 8 to 13 states that have reached that 70%. But now the concern is we won't have the full of where we really want to be for everybody as a nation by the 4th of July. So you have to realize that the risk factor is different. If you live in a state that 75% of your people or 70% are vaccinated in the state that you live, then that risk for that Delta coming in that area and surviving is a lot lower than you live in a community where 25 to 50% of your people are vaccinated, maybe with 1 shot, hopefully with 2. Where's the Delta going to go? I got more room to play over here than I can over here. Right. But our communities were already the hardest hit. And so we can't take another. And what I try to tell people is the health system also took a hit. It took a toll on our health system. Mm-hmm. And so we can't go through another mass, what we went through. Would we be able to do it? Absolutely, because we're resilient. But it'll be a price for that. Because I tell people, the doctors and nurses, it wasn't just taking care of COVID. Like Dr. Mcguire is in the hospital right now at Roseland and on call. I still have kids. Everybody has everything else that they're doing. And so those nurses and doctors who work, and whether you were a lab tech or you did transportation, it was a team effort, respiratory therapy. People still had kids. And so they were trying to Zoom with their kids at home. And maybe you had a spouse that wasn't working. So it was trying to balance all that and not only be there for that patient physically, but to be there spiritually and emotionally for that. And to go back and do it again and again and again. And so I think that when we make the decisions to educate our communities, you really got to make that looking at, I am my brother's keeper, right? And how do we take care of each other and educate those, not judge. And I think, sometimes we make a mistake when we want to, well, you should get the vaccine. It doesn't work that way. You need to understand the why first and then engage to be able to understand and then take information that helps them make a better choice for themselves.
Yeah. And It's a process. It really is. I mean, sometimes it takes 6 and 7 exposures with some of my patients before they say yes. And not only our patients, here at Roseland, I was doing lunch and learns at 12 o'clock every Wednesday for the staff. We started out with a 30% acceptance rate just for the staff. And now we're at 85, 90%. But that took 6 months of me every Wednesday educating other nurses, physicians, lab techs on how the vaccine works, how safe the vaccine is, and the importance of healthcare professionals being vaccinated. So yes, it is a race now. It is a race. We've got this Delta variant that is more contagious. It's going to look for hosts that are unvaccinated, our communities that have low percentages of vaccinating folks. So it's a race for us as healthcare professionals to get these shots in arms to help to save our communities.
Thank you. I think this is a perfect segue into one of the questions. If I'm vaccinated, but my children and sister are not, should I still wear a mask around them, or should they be wearing a mask? Who's safe?
So what we do is we tell people there's a couple of things. If do you have any underlying health issues? Because let's remember, it didn't say you can't get COVID. It says that when you're vaccinated, you have decreases in chances of death and the severe complications. But if I'm someone that has diabetes that we mentioned earlier, or I have hypertension, or I have autoimmune disease, even though I'm vaccinated, I'm not going to be comfortable with people that are not necessarily vaccinated. It's a little more comfortable for me, right? But as far as long term, and because of this Delta variant right now, and I don't know where my sister and her kids have been, intentionally or not, they just might have been at Walmart and didn't wear a mask and picked it up. It wasn't intentional, but then to be able to expose yourself to that, no. When you are vaccinated and you are in an area where, as it says, the community or the people that you're around and your family is vaccinated, then absolutely you can be able to take that mask off. You know, the holidays are coming up. You know, you can be able to eat, sit down, and enjoy one another, because we realized that it was airborne and a lot of COVID got spread through, eating and things like that. And so you have to still be mindful of the environment, and you love them, but that's not enough right now. And again, really because of the Delta variant right now, which we know, and let's think about it, 3 months ago we weren't even talking about a Delta variant in the United States. We weren't talking about it here, but now it's become an occurrence here, and it's up to, in some places, even though our positivity rate is down because we've all been fighting this together. At the same time, the fact that it has a foothold now, and you know how it moves, or you're predicting how it's moving, and you also know that you have communities that are not vaccinated, it has an opportunity to really move and change this ball game to a total different direction. And so you have to know and keep all of that in mind when you make a decision to take a mask off, though we are all so tired of wearing them.
So
that's why we still say hospital, on public transportation. That's why there's still guidelines, depending upon where you are, that there are requirements in an establishment. So if you're getting on a bus, if you are in a hospital or in clinic situation, we are still requiring that you wear a mask, because there's no guarantee that 70% of the people that you are walking in with have been vaccinated.
Absolutely.
Thank you. Dr. Mcguire, did you have anything else to add before we moved on to the next question?
No, I agree, of course, with Dr. Lisa Green. I move around just like it was day one of this global pandemic, right? With my mask, hand washing, all those mitigating activities that we have really helped others to engage in. I still do, and really focus on those activities with my patients and my family.
And the good thing is what we saw this year, liking it or not, is that we didn't, the complications of the flu, for the
That's
death
right.
from the flu and people getting the flu, how many days off. I have parents say, you know what, I have to take out every year because my kids bring something home to me and they got the flu and I'm out. I realized this year, none of us got the flu. It's amazing. And so it was because we became more conscious of washing our hands and wiping things down. And I had a mask to protect myself from you and you from me. And it did make a difference. Right now, in some instances, of course, it's very difficult to wear. People were having, it's anxiety. There are a lot of things. If you have sinus issues and things like that, some people have an allergic reaction to the cloth that they would use, and that's why some people would wear them under their nose, on their chin. But for the most part, we saw the effect on the flu, because imagine if we had COVID and a major flu outbreak, where were they going to go? The hospital beds were already full every place else. So we do know that those measures have been effective.
Yes, very effective. Great point. The flu numbers this year were very low. Very, very great point.
There's a question in the chat. I know J&J did a study on blood clots. What about Pfizer and Moderna?
Well, Pfizer and Moderna, to my understanding, and I'm not 100% sure if they looked at necessarily blood clots, but they did look at cardiovascular events and thromboembolic events, meaning by that, which is a form of blood clots, right? Pfizer, of course, Johnson & Johnson, after they had the issues that came out, they had to take a deeper dive. All of the vaccines, though, have not stopped studying. Let's remember this, the fact that even though we did the initial were what was called clinical trials, and that was because at that point we were now giving the vaccine to people and we recorded, and this was the first time that you ever had that many African Americans and Latino people that participated in a clinical trial before. And you had people that looked like us, that were not just on the FDA side, but on all areas of it. And some people said, well, how do you know they want to sell out? And they were just there but I think people realized it was too much at stake this year. Just like for Dr. Mcguire to get the shot earlier on, which I applaud you because you did it faster than me, back in December, because I was not there yet. But people realized the stakes were high. And because we didn't want, we knew we had the fear of everything else that was there. So to answer your question, there are still ongoing information, not just here in the United States, but they're doing this across the world to ensure, are there any outcomes, not just for blood clots, are there any issues with kidney failure, they're checking for fertility, all these things that we're talking about and cautious. All of those things are currently still being evaluated and watched, as well as the side effects.
Okay, we have quite a bit of questions that are geared towards children. So we'll get started with, how do we know the vaccine is safe for children 12 and above? We have not had the vaccine long enough, so how can we be sure it's safe?
So in part of the trials and the studies that they did, it took a minute, and that's why originally we didn't go to kids first, right? So you realize we started with them later on, but their immune system is differently equipped than ours because they're younger. It's just a different process. And so because of the studies that they've done, though small enough, they didn't see enough adverse side effects to say that, oh, you know what, we should hold off and we should not get this. So no difference than when we look at now, we have the varicella vaccine, right? So the varicella vaccine is something that we give for the chickenpox, but we realize, instead of one vaccine, we need to give two. We realize now for HPV, we realize with different vaccines that we had to change and to move. So vaccines being given to kids has something that's been ongoing looked at, just not this particular vaccine. So now what they're doing is taking a closer look in kids to ensure that it is safe, but not again just in the United States. This is in Israel. This is in every country that you can name right now is trying to take a look to see, and they want to make sure that A is safe, B, and that it's going to, and it goes back to doing no harm, because that's what people were concerned about. Well, if I give my kid this vaccine, how do I know that they're going to have kids 10 years from now? How do I know that they won't have a heart attack later? How do I know? And some of the guarantees we don't know. But what we do know is some of the effects of COVID and those long-term effects, and we haven't even got a chance to really study all the long haulers that are still having problems. So let's remember, everybody that got COVID that thought they were okay, I still have people that don't have a sense of taste, don't have a sense of smell. I have people that have severe headaches. I got people that have COPD now that didn't have it before, people that are on insulin, people that are still having major issues, though they're not on a vent and they're at home, not to mention the anxiety that they deal with now, just some of the other mental health issues, some of the thought. So there's a lot of things that have happened in that group. But what we look at is for kids that, especially that have higher risk, because you do have some kids that have autoimmune diseases. You do have some kids that have asthma. You do have some kids that have diabetes. So those are all answers before people, and I tell people, before you, if you're on the fence about giving the kid, a child a vaccine, that's really the importance of engaging a conversation with your physician to make that choice. Is this the best option for me, right? If you don't want to just go to get a vaccine, or to sign up for a walk-in, I highly encourage you to have that conversation with your primary care provider, to your pediatrician, to say, hey, I've got a kid that plays sports, or hey, I got a kid who's really, inside most of the time anyway, and so I don't really think he's at risk. Those are the questions and concerns that you have to have with your primary care physician, with your pediatrician, because then what they can do is they can sit down with you and individually, again, look at risk versus benefits, not what's on social media, but what pertains to you and your child.
Absolutely. Those benefits of getting the vaccine outweigh the risk of getting COVID.
Thank you.
Yes.
So are we any closer to the vaccine being available for all children anytime soon?
That I am still not aware of yet. There's still work in that arena, because let's remember, it's, do we give it to kids that are younger, and now do we need a third, and do we need a booster? And now we got a Delta variant. So it's, everybody is still working to map all of those out, and you go by the areas that are largest at risk first. And so that we have not been given that final guideline yet for younger children. Do we make this part of the 2-month, 4-month, 6-month vaccine? Not sure yet. And you have to really look at, because you have a lot of people now that are concerned, even with those vaccines, that did it cause autism? So should I give? There's still a lot of vaccine hesitancy now, not just with COVID, but with vaccines in general. So all of that has to then be mapped out and reviewed before there is a final recommendation on what it should be like, or what age limit it's going to go down to.
Thank you. Just a few questions about second dose. So one is, I missed my second dose. Am I still protected from COVID? A similar question with missing the second dose. Do I need the second dose? Should I reschedule? Since the first dose, I found out I was pregnant. Should I get the second dose? So just a few questions around the second dose.
Yeah.
I'll let Dr. Mcguire go first, because I know she's got a hard stop while she's in the hospital.
Right. Yeah, it is recommended. Yes, it's recommended that if you miss that second dose, you get that second dose. Even if it means that second dose is 6 weeks late, 7 weeks late, 8 weeks late, get that second dose. It is important that you get the same dose, the same company dose as the first time. So if you got Pfizer the first dose, get Pfizer the second dose. Not a lot of studies out there of intermingling vaccines. So if you've missed that second dose, please get that second dose. Yes, it is still going to help to reduce and to remove the fact that you could die from COVID or have a severe infection and hospitalization. Get the second dose.
Thank you so much, Dr. McGuire. We know that you have to drop off the live, but we really appreciate you and thank you so much for joining us, but most importantly, educating everyone today.
Thank you so much.
Thank you.
Thank you, Dr. McGuire.
Okay.
And I got like 3 minutes left. Sorry about that.
Okay. Dr. Green, no, always a pleasure. And thank you for hosting today. We really appreciate you, Dr. Green. And thank you for just being not only an ambassador for, your self and your family, but for community. So we just want to thank you again, Dr. Green.
Oh, no, I thank you guys for, at the Cook County Department of Health is not labeling communities, but engaging them. Right. And I think what's happened is a lot of times, we label, well, they know and they should have. And, oh, well, we've done what we can. They're only going to. And this is all that they can do. And this is all. But I think you guys have done a phenomenal job with reaching. Right. And that's all we can do. Right. Is we continue to reach. We continue to educate, we continue to inform. And I think the platforms and the availability that you've made, especially for those of us, like my health center, we only have a certain amount of resources, right? And it's not always just about the funding, but sometimes you need a hand to put up a tent and put out some flyers and get some information and get the word out. So I think you guys, Cook County Department of Public Health has done a phenomenal job. When I look at the map on the news and they show, Illinois and our numbers were high up in there, I was like, okay, that's a result of the work that's been done and that we have not forgotten and labeled the communities, but we're reaching back and lending a hand to them to help them get there. And so if I can do anything to help that, that is what I'm here to do. And so I thank you so much.
Thank you. Thank you. Thank you so much, Dr. Green. And thank you for joining us tonight.
All right. Have a good evening.
You too, Dr. Green.
Bye-bye.